All right, good afternoon. I'd like to call the February meeting of the Health Committee to order on this January 31st, 2022. We have 4 members present, so we do have a quorum. We have approval of minutes from January 3rd. Is there a motion? Motion by Martin, second by Chung. Any additions or corrections? Okay, hearing none, all in favor? Aye. Any opposed? Okay, pass that. And so we originally had somebody scheduled, a member of the public, but I do not see that person. So I think we will move on to Departmental Matters. Suzanne Scott, Adult Detention Medical. Oh, he just walked in.
Okay.
Hang on, Suzanne.
Come on up, Zach. I'll have you down here at the end.
Doesn't make either one. And on the right, on the bottom, on the right.
The face.
There you go.
Sorry about that. Okay, thank you. Sorry about being late. To the most honorable and esteemed county board members, I know most of you are big fans of my reporting. A lot of you out there. I did want to address some of the discrepancies that we've gotten from the COVID numbers. Obviously, I get research requests directly from the jail. On the 28th of December, I get one in saying, oh, there's like 50 different cases. And then a couple days later, last month exactly, Miss Scott is here and says, well, there's only 3. I'm like, oh, that's a pretty dramatic shift. Next day, the sheriff says, oh, it's only like 5. And then I get another research request, usually about a week later, saying, again, it's like 59 or it's in its 60s or something. And then on the 11th, the sheriff gives an interview, says it's under 10. Then I get a research request from the very next day saying it's actually 69. So again, these come directly from the sheriff's office. I've actually seen the emails. They literally email Ms. Scott the numbers that I request and she sends them back. So I definitely, it's not surprising with this new variant that is more contagious but less serious, that even a place like McLean County Jail that has had very few COVID numbers, like 90% of all their inmate COVID numbers happened in the last 2 months. But again, it's not surprising that we would suddenly see a large spike there, but why there's so many issues between what's being reported through the FOIA requests, which, they can't just make up information that they send in the FOIA request. And then what's being reported is definitely concerning. I would definitely like a little bit more information on that, simply because I don't want to report false information. If it's actually that they're less than 10, great. I would rather there be very few COVID cases than a lot of COVID cases. But either way, we just need, accurate transparency, which is something we typically don't get from the sheriff, unfortunately. They also had a vaccine clinic on the 19th, and they, according to the records they gave me, they had 11 new inmates that got vaccinated, which is great. The last one they had was in September. Obviously, we're not going to force any inmates to get the vaccine if they don't want it. But I do think that there's an opportunity at the jail, at least from an educational standpoint, to address vaccine hesitancy. And there's plenty of groups, whether it's Department of Health, the NAACP, that I'm sure would be happy to come in and say, hey, these are the actual facts about it, just to make sure that we're getting everybody that can be vaccinated. Obviously, there's some people, they won't be at the jail very long, but there's some people that have been in there since before the pandemic. Now, obviously, they're probably in there on very serious crimes, but still. So I do hope that we can get some of this information figured out. And all right. And also, all the sheriff's department researchers need a raise. It's criminal you haven't given them a raise. And Ms. Scott needs a raise too. Thank you.
Thank you. Now we can move on to Departmental Matters. Suzanne Scott from Adult Detention Medical.
Thank you.
Hey there, you have no items for action. You have your report. And is there anything you'd like to say or anything like that about it?
Well, we had a very busy December, so we're hard at work doing serial COVID testing. We have had vaccinations in the middle of the testing. Um, we've addressed every FOIA request as quickly as we can. I don't always do all the parts of the FOIA request. They come to me after they've been done, partially by the Sheriff's Department. So we try to keep the numbers as accurate and timely as we can, but it's busy. So
Okay.
other than that, that's kept us busy for the whole month of December and January too. So
Thank you. And does anybody have any questions for Ms. Scott? Member Chung?
Yes, thank you. Hi, Ms. Scott. I guess I was just wondering then, are there any positive cases right now of COVID at the jail currently?
yes, we did our last round of testing today, actually. So those results aren't back yet, but we quarantine our positive results for 10 days after the date of testing. So right now we have 9 in quarantine. Those that have tested from the 24th to the 28th. So those will be in quarantine for 10 days. And we don't have the results back from the testing of today.
Thank you. So, and then because I know the last time when we saw you, you were doing quite a bit of testing at that time, and I know that it was like you finish one round and then you start the next round. That's what had been happening.
Yeah.
How often has the testing been going on for? I mean, is it still are you still doing that same thing, like where you're
Yeah,
doing like
originally we were doing every 3 days. Then from the health department, we had a conversation and said it could be 3 to 5 days. So we've kind of split the difference, and we test every Monday and Friday.
Thank
At
you.
least at this point, yeah.
So these 9, let me think now. I guess I'm doing math and thinking about
Yeah.
the calendar. So these 9 cases that are in quarantine are positive cases from the last round of testing you
From
did.
the
possibly
24th and the 28th.
Okay. And then have you, I guess, I don't know if you have these numbers, but, we've kind of seen here in the community that the numbers have been kind of going down, hopefully so, in the past week or so. Have you seen those sorts of numbers as well in the jail? Have they been going down as well?
From the beginning, when we started testing in December, around the 13th or the 14th, we were pretty consistent with having the total number of positive tests each time we tested. So we sort of settled on that not being the case. At some point, we had an increase. So from that increase, we had some decreases. So it's a wave, and that's what we're seeing. Yeah.
Thank you. I guess one more question. I guess and so you're doing PCR. I wasn't actually quite sure what test you're doing. PCR test, the nose swab.
PCR. Yep.
Okay. And then the inmates that do test positive are quarantined for 10 days, and then they're released back into the population. But they're not.
Yes.
They're not tested or anything at any other point. Well, no, I guess you can't really do PCR tests because they'll probably come back positive. So you're not
Yes.
doing any sort of like rapid test or anything before they're released or anything.
No.
Okay. Thank you so much for all those.
Oh,
for all my
no
questions.
problem.
Thank you.
Any other questions? Member Johnston?
I did have a question. Is there any kind of education going on there that's available to them about the vaccine to address some of the hesitancy?
Probably not as much as we'd like. We we post when we're going to do a vaccination clinic a sign-up sheet, and we take requests as they come in and put them on that sign-up sheet. Now, people do have questions when they come back for sick call, and we promote the vaccine as much as we can when we see an inmate for any reason. We ask on intake when they come in if they've been vaccinated, or if not, why not? And if we can answer any questions, we will. We don't have a whole lot of time to interact with each new custody as it comes in, but when we do, when we have the opportunity, yes, we promote the vaccine. So have they been able to attend a meeting about the benefits of having the vaccine? No, I can say no. There hasn't been any meeting or any group discussion about having the vaccine versus not. But anyone who signs up is already pretty convinced that they would like the vaccine. Some have asked for a booster vaccine, and we've been able to offer that as well. So I would say that we're the vaccine's biggest promoter. We would love to have everybody vaccinated, but then we can't force anybody to be vaccinated. So they have to sign up. And then even when they do, on the actual day of testing, they've decided no, they didn't really want it after all. So that's an opportunity for education. And I think in our situation, what we say gets passed around pretty quickly. So if one patient, hears our story, our recommendation to have the vaccine, they will pass it on to the next one when they have a conversation. So it's not that we can't reinforce and readdress any opportunity to give information, but we haven't had a group discussion.
Sure, thank you. Do you have any even approximate idea of what the percentage is that's vaccinated in jail?
I hesitate to say without the numbers here, and I don't have the numbers here, but I do, if I have access to my data, know the number of how many we've vaccinated.
Okay.
I don't know how many have been vaccinated in the community
Okay.
and then come into our custody.
Okay.
So I don't know that.
Okay.
Not with any reliability.
Okay. And I noticed that with all the cases and all the testing that's been done in December, we had 2 patients that had to use respiratory therapy, and one of them, it looks like, had to go to OSF because of hypoxia. What does the respiratory treatment consist of at the jail?
What do we do for respiratory treatment? We
Yeah.
have nebulizer treatments.
that's
We
what I
do
was
have
wondering.
oxygen available as well.
Did you have to use oxygen in December?
No, we
Okay.
caught the hypoxia early on
Okay.
and sent him right out. There was no warning that he was going to be low when he was low. So had we known he was heading that way, we could have administered oxygen. But when we had contact with him in the state that he was in, there was no question that he was going to go out to the emergency room.
Okay.
Yeah.
And the last question, for the current testing, is it still just population-wide, or is it only symptomatic getting tested?
Population-wide.
Okay.
Yeah, and we don't retest the ones who've already been positive.
Okay.
Yes.
All right, thank you.
You're welcome. Any other questions? Before you go, I think that there was a lawsuit, and if Mr. Spanos could, I don't know how much you know about that, so if Mr. Spanos could maybe talk about that, please.
Sure. There are at least a couple of COVID-related lawsuits from inmates in the jail or former inmates in the jail complaining about the conditions. Today, we won in federal court a motion for summary judgment in which the judge wrote, and this is a quote, "The court finds that these steps taken by Sheriff Sandage and his staff at the facility were a reasonable response to the coronavirus and further finds that no reasonable jury could conclude otherwise." And while the gentleman's name was Groves L., may have done things differently were he in charge of the facility, and while he may believe that Sheriff Sandage could have and should have done more, that is not the standard. The standard is whether Sheriff Sandage's actions were a reasonable response to the threat posed by the coronavirus to Groves L. The court finds that it was. So that case is decided today. So Mr. Grovesell will have 30 days to file an appeal, but we expect the same or similar outcome in the other cases that are currently pending.
Anything else? Member Chung?
Could I ask Mr. Spanis a question about that? Is that all right? Okay, thank you. How many open, I guess you said there are a few other cases. How many other open cases are there then?
I think there are 2 or 3 that relate to COVID,
Okay, thank you.
this being
One of the 2 or 3, okay.
Okay. Thank you.
Thank you.
If I might, just for context, tell you.
Microphone, please.
Thanks. They're all pro se, brought by the inmates themselves. And I don't know if any of them have been appointed any counsel.
Okay, thank you. Next up is Jason Tabb, juvenile detention.
Good afternoon.
Hi, you don't have any items for action either.
I do not.
You have your report. Is there anything you would like to add?
No, but I'll be happy to answer any questions.
Does anyone have any questions for Mr. Tabb? Hearing none, thank you.
Thank you.
Next is Jessica McKnight, Health Department Administrator.
Hello.
You don't have any items for action and you have your monthly report. Is there anything you'd like to highlight or make any comments on about probably things that might have changed since it came out?
Luckily, I don't think many things have changed. Numbers are still improving, which is good, but I'd be happy to answer any questions.
Questions for Ms. McKnight? Member Johnston?
Thank you. I noticed in the report you had the information about the COVID, that had at-home COVID testing and how people can order it. I do know that one of the Biden administration's efforts has been to get the N95 mask. And as far as I know, Meyer is the only one in town that's distributing it. Do you know if anybody else is distributing those for the administration or?
I do not know the list of federal pharmacy partners, but I will, as soon as I do, we'll definitely share that with the public.
Because I think that people were very excited about being able to get those for
Yes.
free.
Mm-hmm.
It's just go pick them up. They did have them when I was at the store the other day. The other question I did have was about the centralized contact tracing and just to see how that transition's going. Are you guys getting feedback from the public about it? And how's staff morale with the change?
It seems to be going okay, as well as can be expected. We are still doing case investigation and contact tracing, still getting calls through the call center. But so far, it has not been a lot of incoming calls, which some other counties, the transition has been a little bumpier. But for us so far, it's going pretty well.
And the staff, have they been happy to have that?
Yes, and happy to be able, again, like I mentioned in my report, we are focusing on outbreaks, congregate facilities. So being able to focus on that has been, it's good for the staff, I think.
Okay. All right, thank you.
Anyone else have any other questions? Okay, thank you. Next up is Mr. Wiley from the nursing home, and he has we'll bring him up and then, or should I do the whole thing? No.
You could read just A, C1A.
Yeah. If the committee is okay with this, I'd like to move A to the end of the meeting in case we have to go into closed session. But we will have Mr. Wiley talk about his report, if he has anything he'd like to add on his report.
Hello, everyone. Just one thing I'd like to point out is some of the metrics that have been identified in this report are the effort of maintaining a baseline, such as with turnover. And we've continued to work on our referral management and census growth. metrics there and identifying trends. The same is in budget management. We've made some progress in developing a system that will help us improve with our accounts receivable and aging. We feel like that's going to be a critical piece from a fiscal standpoint. So as far as the turnover rate goes, I feel like we have a good starting point, especially in light of how COVID has affected the healthcare industry. And it was also reassuring to me to look at our current staffing situation and essentially rule out that we've ended up where we are with our staffing needs because of attrition. It just seems to be that we're fighting the market, but holding steady ground. And then I am excited to say that in January, we gained even more momentum with CNA and nursing recruitment. One nurse and 5 CNAs, I believe, already in January, with 1 or 2 CNAs yet to onboard. So that was a pretty big step for us in January. Any questions?
Do you have any questions? Okay. Thank you. Next up is County Administrator Cassie Taylor, and she has 3 items for action.
I do. Thank you, Chairman Schaefer. The first is E1A. That's a request for approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation for the jail medical. That is a cleanup item for end of fiscal year 2021. This is an annual task that we do in relation to cleaning up the books so that we can get ready for our audit. We took monies away from the full-time salary lines because, as you well know, our nursing staff in the jail were not at full capacity, and we had extra expenses for medications, including some COVID-related medications and vaccines, and hospital expenses for inmates.
Can I have a motion? Motion by Johnston, second by Metzger. Any questions? Discussion? Okay, hearing none. All in favor? Any opposed? All right, that one.
Okay. Next is E1B, request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for the nursing home. And this is the completion of the project that took a long time to complete. It was the upgrades required by CMS for the electrical and sprinkling systems. And so that $290,000 for the contract services is in relation to the project management and completion of that work.
Motion by Metzger, second by Johnston. All in favor? Or any, any opposed? Okay, no, because nobody had any questions, right? All right, that one is approved also, and your final one?
Final one is E1C, request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance. That's found on pages 31. This is in relation to the extra staffing that is currently needed at the adult medical facility at the jail. As you heard described earlier in this meeting, as well as in previous meetings, we have ongoing COVID testing, COVID response, as well as a shortage of nurses. We want to make sure that the residents in our care have all the medical needs met. And so we have made a budget amendment in relationship to that.
Motion by Martin, second by Chung. Any questions? Hearing none. All in favor? Any opposed? And that's approved. You have anything else?
I have nothing else to present. Thank you.
Okay, thank you. On other business and communication, please note that our next meeting will be Thursday, and on Thursdays from now till the end of the year at 5:30. So please change your calendars if you have not yet. Does anybody else have any other items? Okay. Then we have bills to pay. And the auditor has approved them, and they follow all of our ordinances, resolutions, and policies. And so, first one is the Board of Health has a prepaid total of $376,429.44. Motion by Metzger, second by Chung. All in favor? Any opposed? Okay, that one's approved. The nursing home is a prepaid total of $238,684.44. Motion by Johnston, second by Martin. All in favor? Any opposed? Jail and JDC Medical have a prepaid total of $136,133.09. Motion by Chung, second by Metzger. All in favor? Any opposed? That one passes. And the Developmental Disabilities Board has a prepaid total of $182,096.56. Motion by Johnson, second by Chung. All in favor? Any opposed? Okay, and that's approved. So we'll go back to item D1A is Mr. Wiley has a request under section 108-43F2B3 of the McLean County Code to authorize department head to offer a salary above the identified in section 108-43F2B2. And I need a motion. Motion by Chung, second by Johnston. I don't know if anybody has any questions. If we have questions, we'll have to go into closed session. Do we have questions on that? Okay. I guess we don't have to go into closed session. All in favor? Any opposed? Okay. And with that, meeting's adjourned. Thank you. And the piece of paper